Yeah, hi everyone. Good evening, guys. How are you all? I
Good
hope
evening, sir.
everyone good, right?
Good evening, sir.
Good evening,
Good evening, sir.
Hope everyone good, right?
Good evening. Yeah, good.
Yeah. So after yesterday, we discussed diabetes, everything, right? Any doubts?
sir. You are not audible.
Not audible?
No, you are
Yes,
audible,
sir,
sir.
audible.
Audible, sir.
Audible.
Yes, sir. Now you are.
Yes, I am audible, na?
Yes,
Yes.
sir.
Yes, sir.
Yeah.
Yes, sir.
Yes, sir, audible.
Thank you. Thank you for confirmation. So we can start today. Chapter 9, hypertension. After yesterday, we discussed the chapter neoplasms, diabetes, glaucoma, and this everything, right? Next chapter, chapter 9, diseases of the circulatory system. Diseases of the circulatory system. Here first condition should be hypertension. What is the meaning of hypertension?
High blood pressure.
High
Elevated high,
BP, sir.
High blood pressure.
yeah, high blood pressure. Good. Increase the blood pressure in the body. So while you are coding hypertension, we have some guidelines. How to code hypertension we can discuss now. So guys, while you are leading a hypertension, after identifying the hypertension unspecified, you need to cross check for the next two conditions, that are, if you find hypertension in the record, for which conditions you need to observe again.
Heart.
CKD, CHF.
CKD.
CKD, CHF.
CKD and heart diseases.
Yes.
Heart diseases you need to identify. So now if they document only hypertension, then you need to code unspecified hypertension. Then, if you find documentation hypertension CHF, you need to code combination code hypertension with CHF and additionally type of CHF. What are the type, like a systolic, diastolic, a combined systolic, diastolic? Whatever they documented, we need to add additionally. Then, if they documented hypertension plus CKD, you need to code I12 series and CKD stage depends on that. What's the CKD stage they documented? Then, if they documented hypertension CKD CHF, then you need to code I13 series, then CHF type and CKD stage. Okay, these all the things we need to code. Remember, while you are coding hypertension, you need to cross check whether the documented chronic kidney disease or heart failure. If there is no chronic kidney disease, no heart failure, no problem. You can code unspecified hypertension. If they given hypertension unspecified, then in the heart failure types, systolic, diastolic, and combined systolic and diastolic. If they mentioned unspecified, you need to code I50.9. So from again, systolic, diastolic, and combined systolic and diastolic divided as acute, chronic, acute and chronic. Correct? Acute
Hmm.
systolic, acute and chronic systolic. Same for diastolic, same for combined systolic and diastolic. Again, three types: acute, chronic, acute, and chronic. What is the specific type of CHF you need to identify and you need to add if they're documented? They're not documented any specificity. They mention like simply CHF or heart failure. You need to consider as unspecified heart failure. Clear?
Yes.
Yes.
Clear.
So guys, now we can discuss very detailedly this combination codes. I will show one chart. You can understood this chart. You will get a clear idea about hypertension combinations. So first patient have hypertension. Okay. We can discuss first hypertension. Patient have hypertension only. No CP, no CKD, no heart disease. Then what we need to code?
I-10.
Only hypertension.
Only hypertension we need to code. Bill I-10, Bill I-10. No heart disease, no CKD. Now, come to CKD side. If patient have hypertension and CKD, only, no heart disease, only hypertension, CKD, yes. Associated heart disease, no. So, only hypertension, CKD. Now, if patient have hypertension and CKD, you need to identify the CKD stage. Based on the CKD stage, they divided hypertension combination code. Okay. I1 to 9 for CKD stage 1 to 4 and unspecified stage. For stage 5 or ESRD, you need to use I1 to 0. Based on the stage here. See. Correct?
Yes.
So you need to
Yes,
use
sir.
different codes for hypertension with CKD. You need to check stage. Based on the stage, you will get the combination code. Okay. If they mentioned hypertension, CKD5, what you need to code?
ESRD.
12-0.
I-12.0.
Hypertension
12-0.
combination code of hypertension and CKD and the CKD stage 5.
Yeah, I1 to 0 and N18.5.
Year
5.
18.6. 5.
CKD stage 5. ESRD means stage 6. Yeah, N18.6. Now, if they mention only hypertension and CKD, not documented stage. Then
I,
I-12-9, sir.
I-12.9.
I12.9.
yes, I12.9. Correct. I12.9 and N18.
In 18.9.
N18.9. Additionally, two codes you need to use here. Hypertension, CKD clear, right?
Yes,
Yes.
sir.
Now come to
Yes,
hypertension, heart failure side. So now patient have hypertension, heart disease. No heart failure, only hypertensive heart disease. Then you need to code I119.
9.
If patient have hypertension and heart failure also, then I110 and type of heart failure. Two codes you need to code. Okay, type of heart failure you need to have. Now, patient have both heart failure, CKD along with hypertension. This is the table. I13 series. If patient have hypertension, heart failure, CKD, I130 based on the 1 to 4 and unspecified stage, heart failure, then CKD. If stage 5 or ESRD, 3 2, heart failure and CKD stage. If patient have heart disease and CKD, no heart failure. Okay, there is
Yes.
no heart failure, only CKD, hypertensive heart disease with CKD without heart failure. These are the codes. Okay, the documented hypertension, heart disease without heart failure and CKD. So please go through this table. If you have any doubt, you can ask me. I will explain. Then, if the documented stage 5 or ESRD, what we need to check along with CKD stage?
So dialysis patient is on dialysis.
Dialysis. If patient was on dialysis or not, we need to check. Go through this document. If you have any doubt, you can ask me. I will explain. No.
Sir, if patient is having CKD stage 5 and his patient is on dialysis, then we have to code end stage, na ESRD,
Patient is in CKD stage 5 and
dialysis.
yeah, ESRD you need to go. CKD stage 5 and dialysis means if there is no dialysis, then stage 5 only.
Sir, if patient have CKD stage 3 and CKD stage 5, then
I
in
will
this
explain
case,
that. Yeah. That guidelines we can discuss at the CKD chapter. There I will cover. Okay.
okay.
We can cover CKD chapter. How we need to stage if multiple stages, everything. We can. Stage 5 we need to code. Okay.
Hmm.
Highest stage we need to code. Yeah. So guys, next. Any doubt up to here?
No.
No, sir.
Yes, sir, clear.
Thank you guys. Next concept we can go. So next, hypertension types. Okay. If patient have hypertension types, combinations we covered now. Next, types of hypertension. Okay, heart disease clear, kidney disease clear, hypertension with cerebrovascular disease, hypertensive and CVA. Patient have cerebro.
You're not audible.
Sir, you are not audible. Not audible, sir.
Sir, you are not audible.
Audible, sir.
So from where I disconnected?
Sir,
STN with cerebral.
Hypertension.
Cerebrovascular disease I covered now. Then
No.
hyper.
no, from
No.
there on.
No, sir.
No, sir.
Okay, no issue.
No,
So
sir.
remember, if patient have hypertension and cerebrovascular disease, hypertensive cerebrovascular disease, then first you need to code cerebrovascular disease, then hypertension. Okay, first you need to code cerebrovascular disease, then hypertension. Then hypertensive retinopathy means you need to code retinopathy, then hypertension type. Then hypertension secondary. Secondary hypertension means what's the meaning of secondary?
Underlying condition like due to some uh, disease
Correct. Due to some other condition,
condition. Huh.
if hypertension develop, we need to code
Secondary hypertension.
secondary hypertension.
Again, explain some hypertension.
Hypertension? I didn't get you. Krishna,
Hypertension CVA. Hypertension
Hypertension
CVA.
CVA, sir.
CVA, first you need to code cerebrovascular disease, then hypertension. I-60 series, type of cerebrovascular disease, then hypertension we need.
Sir,
Yeah.
hypertensive retinopathy also tell once.
Yeah, first retinopathy, then hypertension.
Okay, sir.
Sir,
Yeah, guys, still lot of people joining after removing the group also. They're not paying, they're joining. This is not correct.
Anna,
Mm.
if we have hypertensive retinopathy, so
Mm.
in this we have like a combination code for that, na? And retinopathy we
Yes,
have to
yes,
code
that only I'm
separately.
saying. Retinopathy H35, you need to code additionally. Okay? Then
Okay, like first,
hypertensive
okay,
combination.
first like we have to code combination code, and after
Mm.
that we have to code like retinopathy in separately.
Yes.
Okay, okay.
Then hypertensive transient. Remember, transient means you need to code as elevated blood pressure. Don't code hypertension. They mentioned hypertension transient. You need to code elevated
Elevated.
BP.
PP.
Elevated blood
సార్
pressure. Don't
హైపర్టెన్సివ్
consider.
రెటినోపతి
చెప్పండి.
హైపర్టెన్సివ్ రెటినోపతిలో ఓన్లీ అంటే హైపర్టెన్సివ్ విత్ రెటినోపతి ఓన్లీ ఒకటే కాంబినేషన్ కోడ్ ఒకటేనా లేకపోతే అన్ని రెటినోపతి కూడా కోడ్ చేయాలా?
H35.0. Okay. See, subcategory
సింగిల్ కోడ్.
H35.0 background retinopathy and retinal vascular changes should be used along with code from category I10 to I15. What's that meaning? చెప్పండి. ఏం చెప్తున్నారు, దాని మీనింగ్ ఏంటి? క్లియరా?
అంటే నేనేమంటున్నా అంటే అంటే I10 ఇచ్చి రెటినోపతి ఇవ్వాలి లేకపోతే హైపర్టెన్షన్ కింద మన రెటినోపతి చూడాలి సార్ అంటే
హైపర్ టెన్షన్ విత్ లో చూడాలి రెటినోపతికి.
మళ్ళీ రెటినోపతి మళ్ళీ ఇవ్వాలా యూజ్ అడిషనల్ కోడ్?
ఇవ్వమనే కదా చెప్తున్నారు. H35.0 కోడ్. Subcategory H35.0 you need to use with I10 series. ఓకే, I10 to 15 సిరీస్ కోడ్ చేసేటప్పుడు ఎప్పుడైనా రెటినోపతి ఉంటే రెటినోపతి కూడా ఇవ్వండి అని చెప్తున్నారు.
రెటినోపతి అని క్లబ్ చేస్తేనే కోడ్ చేయాలా
అర్థం కావట్లా?
సార్? హైపర్టెన్సివ్ విత్ రెటినోపతి అని ప్రొవైడర్ క్లబ్ చేస్తేనే అప్పుడు కోడ్ చేస్తామా రెటినోపతి?
అంతే కదా,
ఓకే.
హైపర్ టెన్సివ్ రెటినోపతి అని చెప్తేనే చేస్తాం.
Sir, please explain in English.
నథింగ్, ఐ డిడెంట్ సే ఎనీథింగ్, సేమ్ గైడ్ లైన్. ఎనీ డౌట్ ఇన్ దట్ గైడ్ లైన్, ఇఫ్ యూ హ్యావ్ టెల్ మీ, ఐ విల్ ఎక్స్ప్లెయిన్. ఇఫ్ క్లియర్, నో యూజ్ నో.
Anna,
Sir,
HTN with cerebrovascular disease. So in this case also like we have combination code for that now separately. So
Yes, first I60 series, then hypertension combination codes.
I60 series after that combination code.
Correct. Cerebrovascular type of cerebrovascular disease. What type of cerebrovascular disease? Then hypertension. I10 to I15 series. Whatever code you
Okay.
will get.
Okay.
Two codes you will get.
Mm-hmm.
Hypertensive retinopathy 2 codes, cerebrovascular disease 2 code, secondary hypertension 2 codes.
Okay.
Then hypertension transient. Transient hypertension means elevated blood pressure. Okay. Do not code as hypertension R03.0. Then hypertension control, uncontrolled, same code. Okay. Same code you will get.
Same code in the sense, Anna.
I10.
Okay.
So there is no
Combination.
separate code for control, uncontrolled. Okay. Same. We should not consider as separate code. There is no separate code for controlled and uncontrolled. Then hypertensive crisis. If they documented hypertensive crisis and hypertension, how you will code? Hypertensive urgency, crisis documented, and hypertensive disease like hypertension also documented. We can code both, okay? Both we can code hypertensive crisis and hypertensive disease type. Both we can code.
Okay.
See, if
So
patient have I16 hypertensive crisis, code also any identified hypertensive disease I10 to I15 series. Okay, the sequencing is based on the reason for the encounter. If they admitted for hypertensive crisis should be sequenced first. If they admitted for hypertensive type disease, hypertensive disease should be the sequence first. Okay, based on the
Sir,
encounter treatment.
what will be the situation for the secondary hypertension due to underlying condition?
First, you need to code underlying condition, then hypertension.
Okay.
Anyway, if secondary means that code should be second. Next,
But if
pulmonary.
the reason for
Hello.
sir, but in that if the reason is for the underlying condition, then also we
See,
have to go to
if
secondary
patient have
hypertension.
secondary hypertension, which means no need to check the reason for encounter. Here you need to check the guideline. Code first guideline. Okay.
Okay. Okay.
Code first guideline we need to follow first. Okay.
Okay.
Then pulmonary hypertension. If patient have pulmonary hypertension, you need to code separate I-27 series. Okay. Based on the type of pulmonary hypertension. So while documented hypertension, first you need to check hypertension, whether they given any type of hypertension like secondary, transient, retinopathic hypertensive, crisis, urgency, pulmonary hypertension or portal hypertension. Okay. Then if they not documented any specific type of hypertension, they given only unspecified, then you need to check type of, then if they documented anywhere CKD or heart failure, if they documented hypertension for CKD and heart failure or heart disease, no need linkage. We can assume. Clear? In hypertension documented in assessment, CHF documented in history, can you assume the linkage or not?
Yes, sir, we
Yes,
can.
sir.
We
Yes.
can assume. Okay,
Yes.
remember hypertension, CKD, CHF, heart disease, we can assume linkage. No need
Yes.
to mention until unless they state that condition due to some other condition. Okay, suppose patient have hypertension, heart disease, but they saying heart disease due to some other condition. They are not mentioning that was due to heart disease. They are not mentioned. They mentioning that heart disease due to the some other condition. At that time, no need linkage.
Anna, if
Hmm.
if we have DM with CKD and
Hmm.
HTN in in PMH it's given like DM with CKD, and in
Hmm.
assessment it's given simple HTN.
Hmm.
So can we link can we code I12.9?
Yeah, sure. Why not?
Okay.
All you need to link DM
Mm-hmm.
combination and hypertensive combination.
Okay. Okay.
Sir, sometimes they mention in past medical history of STN. Can we link?
Yes, yes. Why not?
Okay, thank you.
అంటే జనరల్ గైడ్ లైన్స్ లో మనం డిఎం తోటి లింక్ చేసినా కూడా అంటే సీకెడిని హైపర్ టెన్షన్ లింక్ చేయొచ్చు
అవును.
అంతేనా సార్? ఓకే సార్.
అంతే కదా. ఇప్పుడు డిఎం ఉంది, హైపర్ టెన్షన్ ఉంది, సీకేడ్ ఉంది, అన్ని కలిపి కొట్టొచ్చు.
ఓకే సార్. అంటే ప్రాజెక్ట్ లో కొంచెం వేరే ఉంటుంది అందుకనే డౌట్.
Hello, sir.
కానీ ప్రాజెక్ట్ స్పెసిఫిక్ అవి మీకు.
సార్
ఓకే
హైపర్టెన్షన్
సార్.
సికేడి
హలో.
క్లబ్ చేసి ఏం సెపరేట్ ఉంటే మళ్ళీ క్లబ్ కోడ్ ఇస్తున్నాం.
ఎస్ ఎస్ ఆల్ కాంబినేషన్స్ యూ కెన్. నో. No,
Or
we should
need
not
separate
combine.
documentation of hypertension.
Actually, na, we have combination code for hypertensive and heart failure only. Hypertensive urgency or emergency, it was separate code. Okay, it was separate code. Only type of heart failure, unspecified hypertension and heart failure. You can give combination like secondary hypertension, hypertensive retinopathy. These all are separate hypertension. Okay. If urgency, heart failure, hypertensive urgency, CKD, pulmonary hypertension, heart failure, don't combine. Okay. Suppose patient have pulmonary hypertension and CKD. Can you combine?
No.
No.
No. You are coding regularly, na, these types of conditions. Then,
Anna, what is HTN crisis? Like which conditions comes under it?
That was severe condition, urgency, that's it. Hypertensive urgency and emergency you will get.
Okay.
Hello? Voice వినిపిస్తలే. I didn't get your voice, bro. Hello? I'm not getting your voice properly.
Hello. Hello.
Yes, yes, I am audible.
Sir, if CKD is mentioned CKD due to HTN and diabetes also separate mention. So can we take diabetes combo code with CKD?
Yes, take. See, I will explain later that combinations, okay? While we are discussing CKD, we can discuss how we need to combine hypertension and DM. Then now we can cover this chapter, okay? So remember, while you are coding, you need to forget while you are here, general guidelines, no project specific guidelines involved, okay? Hypertension, CKD, DM combination, I will explain at the CKD chapter. Don't worry, okay?
Okay.
Thank you.
Hello, sir.
Don't involve DM here, okay? Tell
Hello.
me.
Hello.
Yes, bro. Hello, tell me.
Sir, if heart transplanted done and heart failure is given, that time can we code?
Arey Baba, what you are saying, I didn't get you. Heart transplant and heart failure, it was complication or not? It will be complication, right? Transplanted heart failure means it should be complication, right? Yes or no? Tell me. It was complication or not?
Yes, it's complication.
Then how you will combine the complication? You will get T series code, right? Then see CAD and angina. How we need to code? If they documented CAD and angina, we need to code combination code. Okay, CAD with angina. Okay, if they documented CAD and angina, you need to code combination code CAD with angina. So next, if the patient have CAD and acute myocardial infarction, what we need to code sequence first? You can read these 3 lines. If a patient have CAD is admitted due to an acute MI, the AMI should be sequenced before the CAD. What's that meaning? They are saying you need to give AMI should be first or CAD should be sequenced first.
Heart failure.
No, CAD.
Myocardial.
They are saying CAD first or heart failure. Myocardial infarction should be sequenced first.
Myocardial infarction.
Myocardial infarction. AMI should be before the CAD, which means first AMI, right?
Yes, sir.
There. Okay, CAD and AMI means code AMI first sequence. Then
క్యాడ్ ఏఎంఐ ఇచ్చినప్పుడు మన ఏఎంఐ ఫస్ట్ చేయాలి సార్.
అదే కదా చెప్తున్నారు అక్కడ. Next, acute MI. Okay, acute MI. What is the meaning of myocardial infarction?
Lack of blood supply.
Lack of blood supply to
Heart.
hmm?
Heart.
కంప్లీట్ ఆర్ పార్షియల్ బ్లాకేజ్ ఆఫ్ హార్ట్.
Lack of blood supply to the heart. That is the
See,
lack of the oxygen.
blockage of blood supply to heart muscles. Okay, heart muscles.
Yes.
It should be the myocardial infarction. The blood supply blockage to heart muscles. It should be myocardial infarction. So remember guys, while we are coding myocardial infarction, you will get 3 sets of codes for myocardial infarction. Acute or initial, subsequent, old myocardial infarction. So old myocardial infarction means any myocardial infarction after 28 days. If you are coding that condition, it should be old MI or history of MI. Okay, 28 days after. Then what is the meaning of initial?
Before 28 days.
Think, sir.
Not before 20. Before 28 days, it should be subsequent.
First
First
onset. First onset.
Oh, sorry.
First onset. Initial means first onset visit. Okay, when the infection developed, that treatment visit should be the initial visit. Within 28 days, follow-up should be subsequent for the same myocardial infection. Okay, for the same myocardial infection, if they follow for the within 28 days, it should be subsequent type. So while you are coding myocardial infarction, first you need to identify type of myocardial infarction and valve where it was located. Clearly we need to identify type 1, type 2 MIR, which area it was STEMI, NSTEMI, acute myocardial valve or inferior valve, anterior valve. More specifically, we need to code myocardial infarction code. So here, if they documented NSTEMI evolves to STEMI, what we need to code? STEMI. Then STEMI converts to NSTEMI?
STEMI.
STEMI.
Yes.
Okay. STEMI only we need to code. Remember, NSTEMI evolves to STEMI, STEMI. And STEMI evolves to NSTEMI, STEMI only we need to code. One question you will get in this concept, patient have non-ST elevated myocardial infarction, what is the ICD code? This question you will get.
Anna,
Code
explain once now.
I-21.4 non-ST elevation myocardial infarction. This question you will get. What is the non-ST elevated myocardial infarction ICD code? Okay. Patient coming with chest pain and elevated troponin, they will give, and they identified patient have non-ST elevated myocardial infarction. What is the code they will ask? We should not code symptoms. You need to code the condition non-ST elevated MI. Clear?
Anna, explain once now.
What is the code for a non-ST elevated MI? Clear, right? Then STEMI evolves to NSTEMI, STEMI. NSTEMI evolves to STEMI, STEMI. Okay. These guidelines you can remember. Then one more question you will get subsequent MI, guys. So subsequent MI, one concept, remember these 3 lines you can read. Here you will get one question. Do not assign code I-22 for subsequent MI other than type 1 or unspecified. For subsequent type 2 MI, assign only code I-21A1. For subsequent type 4, 5, assign only I-21A9. They will give question, which category codes we can use for type 2 subsequent MI? Which category code we need to use, I-21 or I-22?
I-21.
Good. I-21 category. Only for type 1 or unspecified type subsequent MI only I-22 category. Okay. If the patient have type 2 MI subsequent, you need to assign I-21 category set of codes. This question you will get. Okay. Patient have type 2 subsequent MI, which category sets of codes we can use?
I-21 ఏమన్నా సార్?
Yeah, it was complete code, they will give category. If they give complete code, I-21A1. Category means I-21 series, okay? Code means
Type 1 లో
I-21.
I-20.
Hello? Actually,
ఓకే
now,
సార్, క్లియర్.
for the initial MI, you will get I-21 category. Subsequent MI, I-22 category set of codes you will get. Okay? Only for type 2 and type 1 and unspecified I-22 category. If they given type 2 or type 4, type 5, you will get I-21 category subsequent MI. Okay? These are rare situation. You won't get maximum type 2 MI. Any doubt? So please ask me if you have any. No doubt.
Sir, can you please repeat it
Which
with one example?
I didn't get you.
Sir, can you please repeat subsequent acute MI with one example?
Yeah, subsequent MI example you want.
డౌట్ ఏంటంటే ఇప్పుడు విత్ ఇన్ 28 days లో సేమ్ సైడ్ కి వచ్చింది.
చెప్పండి. విత్ ఇన్ 28 days లో this question you will get LME, then subsequent MI. Yeah, this is a second subsequent code. I-22 series. Patient is suffered an acute STEMI 14 days ago. 14 days ago means it was subsequent, right?
Yes, sir.
And is now seen for inferior STEMI, which means it was new MI. Patient have STEMI and new MI. Both. Okay? STEMI and subsequent. Both we need to code. Clear? Here patient have subsequent MI. In the subsequent MI follow-up, they find again new initial MI. At that time, we need to code both. That only doubt kada meedi?
అవును సార్.
We can code both. In the subsequent period, if they find new MI, we need to code additionally subsequent MI and new MI both.
We can code both in exam.
Regularly also we can code both. What happened?
Okay.
So patient was 1 MI. In the subsequent period for that MI, they came to the hospital. They find again new initial MI, some other location. Then you need to code both. It was different, right? Newly diagnosed MI in the subsequent MI phase.
Yes.
Can code both. Clear? Next, I will explain a small chapter, your CKD, DM chapter we can cover, guys. Next, come to the CKD chapter. Here, chronic kidney disease. So first remember, if they documented CKD, what we need to identify?
Stage of the CKD.
Stage, okay. Based on the severity, they divided stages. Based on the which lab test we can identify the CKD stage?
GRF.
GRF, glomerular filtration rate, GFR. This question also will get in exam. Based on the which lab test we can identify the CKD stage? GFR, glomerular filtration rate. Note down this question, okay? Based on which lab test we can identify the CKD stage? Glomerular filtration rate. Based on this level, we can identify the CKD stage. So next, mild means CKD mild means
Stage 1, 2, and 3.
Stage 1, 3. CKD stage 2 mild. Stage 3 codes moderate. CKD 4 severe. then end stage. Okay?
ESRD.
Yeah, ESRD. So now remember, if they documented 2 stages, what they are saying here, if the patient have CKD and ESRD, what we need to code?
ESRD.
ESRD.
ESRD. Okay,
ESRD
highest
along with
stage we need
dialysis.
to code when 2 stages documented. This question also you will get in exam. Please note down. Please note down this question, guys. Same question you will get stage 5 CKD, ESRD requiring dialysis. How you will code, they will ask.
End-stage
ESRD
renal
and
disease
dialysis.
and dialysis.
Yeah, ESRD and dialysis, same question codes also you can note it. Same you will get. Clear?
Yes.
Then chronic kidney disease and kidney transplant status. Okay, which what happen now? Suppose patient have CKD. Okay, they done transplantation. Okay, after the transplantation also still patient have CKD. Can we consider it was transplant complication or not?
Yes, sir.
Yes.
No, we
No.
should not consider as complication. Why? Because after immediate transplantation, CKD should not cure. Okay, it was some other complication we can code. See, patient who have undergoing kidney transplant may still have some chronic kidney disease because the kidney transplant may not fully restore kidney function. Therefore, the presence of CKD alone does not constitute a transplant complication. It's not a transplant complication. Okay. Assign appropriate N18 series code and transplant status code. Don't code kidney transplant complication by default. It will take time to fully restore the functions. Okay,
Okay.
clear?
Yes.
Yes, sir.
Thank you. Any doubt, CKD? Now, CKD. Yeah, next. Your doubts ask me. CKD, hypertension, DM. Now ask your doubts. I will explain. Ask all our doubts in these 3 conditions. We will get one question also anyway. Ask your doubts. I will explain. Patient have CKD, DM and hypertension. In exam also you will get one question. So whatever you have doubts you can ask me. What I am saying, you need to code I12 series E1122 DM complication then CKD. In this sequence we need to code. Okay?
Okay.
Okay.
Thank you. Now clear hypertension, DM, CKD.
Anna, here also CKD sequence like matters. Like first we have to code DM, after that SGN, after that CKD. Like that we have to code, or simply we can like randomly we
No,
can code.
remember if patient have CKD,
Mm-hmm.
okay, diabetes, hypertension.
Hmm.
Check reason for encounter. If the
Okay.
reason for encounter was unrelated, these all are documented in history.
Mm-hmm.
Okay,
Hmm.
these are not reason for encounters. Then follow this guideline: hypertension combination, DM combination, then CKD. Okay,
Okay.
then reason for encounter related to diabetes complication. Then 1122, then I12, then N18. Then Reason for the encounter should be related to CKD. Then this combination,
If
this
we have,
sequence,
okay, okay.
same sequence.
Okay. If we have CHF, then in the place of I12 we can like
Use
code
I13.
I13. Okay.
Correct. I13, then CHF, then 1122, then N18.
Or there is like any relation between AKI, acute kidney injury, or DM?
Then you will get combination code. If they said AKI due to DM, we should not assume directly AKI.
Okay.
Clear? Can you coding AKI DM directly come? You are assuming?
No,
No.
no, no.
No. There
No.
is no guideline. If they mention AKI due to diabetes, then you can code combination. That's it. If
Okay.
they are not mentioned, we should not assume. I shared the list, right? We discussed no DM
Mm-hmm.
complication list.
Yes, yes.
Okay. What we need to assume, what we need to check for linking directly. If they link that condition, then you need to complication. Some of the conditions no need to link. We can assume. AKI we should not assume directly. Then while patient have ESRD or stage 5, you can check for dialysis. Okay. Dialysis also we need to check. We need to code dialysis also.
Anna, if patient have CKD stage 4 or dialysis, so can we consider ESRD directly?
No, only 5 and ESRD only. Sorry, 5 and dialysis only ESRD. Remaining
So,
other stages we should not consider as ESRD.
so we can code like a CKD stage 4 and dialysis like that.
That's it. That's it.
Okay.
Okay. If
On the
any
basis of,
stage they will use dialysis, remember. If they use any stage dialysis for acute kidney failure, also they will use dialysis. If
mm-hmm.
using dialysis, which means not ESRD.
Okay.
Okay.
Okay. Like in the on the basis of CKD stages, we can't consider patient like dialysis.
How we can consider? Remember, the golden rule of coding, if they documented, we can code. That's it. If they have ESRD, simply not documented anywhere dialysis, can you assume and can you give dialysis? No.
No.
If they documented dialysis, we can code. Otherwise, how we will code? We should not assume anything in the coding. What they documented, we need to code. That's our duty. You should not assume anything. Might be chances, definitely. If ESRD means definitely they are on dialysis, I need to add means it was wrong. If they documented dialysis on the visit, we can code. Not documented, leave it. Okay.
Okay.
Hello.
Next. Hello.
Hello, sir.
Yes, yes. Tell me, bro.
Sir, if documentation given hypertensive urgency and CHF at that time, urgency also guideline for code also for hypertension. At that time, can we give a combination code for
No. See, only hypertensive urgency and CHF means how we can code combination.
no, but urgency has a guideline for code also hypertension, no?
Yeah, if the documented hypertension, you need to code. Okay. Hypertensive urgency documented, hypertension documented. Then you need
Yes.
to code both. If there is no hypertension, how we can code? You are asking if they mentioned hypertensive urgency, we can code hypertensive urgency and hypertension, right?
Yes, sir.
No, we should not code. You need to code only hypertensive urgency.
But if it is in the history, then
You can code hypertension anywhere, right?
yes, sir.
Urgency we should not code from history, okay? It was
Yes, sir.
acute condition. If assessment hypertensive urgency, history PMH hypertension, you can code hypertensive urgency and hypertension both, okay? Next chapter, ulcers, okay? Diseases of the skin and subcutaneous tissue, L series chapter. So here we will get pressure ulcers and ulcers. So first thing, pressure ulcers. While you are coding pressure ulcers, what we need to check? stages of the pressure ulcer. Okay, they divided pressure ulcer as 1 to 4, deep tissue pressure injury, unspecified and unstageable. Depends on the stage and location, you need to code as the pressure ulcer. What is the other name for pressure ulcers?
Decubited ulcer.
Decubitus ulcer. Decubitus
Yes.
ulcers also considered as
Pressure ulcer.
pressure ulcer.
Sir.
So while you are coding multiple pressure ulcers, they documented. You need to code first higher stage of pressure ulcer, then lesser stages. Then next question, listen carefully. Oh, this was where is oh. Patient admitted with pressure ulcers evolving into another stage during the admission, which means patient was inpatient here. Okay, is patient admitted to yes inpatient hospital, while at the time of admission patient have stage 2 ulcer, sacral stage 2, stage 2 sacral ulcer at the time of admission. After 5 days in the hospital, nurse checking the stage of the pressure ulcer, it was progressed to stage 3. Okay, stage 2 to stage 3. So now how you will code?
Both.
Which means
Have to
both
code
we need to
primary
code.
stage 3 and secondary hypertension.
Yeah, we need to code both here. Both stages you need to code. If the stage evolves to one stage to other stage, we need to code for the admission at the time of admission. What is the stage they documented? After admission, what is the stage it was progressed? Both stages we need to code. Clear? Two
Yes.
codes you need to add. See, if patient is admitted to an inpatient hospital with a pressure ulcer at one stage and it progress to a higher stage, two separate codes should be assigned. One code for the site and stage of ulcer on admission and second code for the same ulcer site at the highest stage reported during the stay. Suppose if they admitted for stage 2, during the stay it was healed. Now
Please
Then
repeat.
we have to
So
code
you
the
have to code.
highest stage.
Heal
now
also you have to code because of admission only patient having healing.
Can you repeat the question, sir?
yeah, 1 minute. What I'm saying, patient have hyper admitted with pressure ulcer stage 2 in the hospital. Okay, while during the stay in the discharge summary, they documented stage 2 was healed.
We can code.
What we need to code at the time of admission stage 2 or the discharge summary healed ulcer.
Okay, no code.
Have
We
to
can
code.
code.
Heal is coded,
Have
not
to
heal
code
is not.
that inpatient state.
Status.
At the timing of the admission.
Hello. We need to code at the time of admission what's the stage, because while admitting patient have ulcer they treated, correct, later it was healed.
We did.
At the time of admission the patient have ulcer, right, they are treated. If you are not coding, how they will get bill?
Yes, sir.
We need to code at the time of admission compulsory. Okay, if it was healed or he not healed, you need to code at the time of admission. After admission, it was healed, no problem. It was progressed to higher stage, you need to code both stages. Then, if pressure ulcer documented healing, can you code?
No.
We need to code healing. It was that mean it was curing, not completely cured.
Yes.
Healed different, healing different. Remember, what is the difference between healing and healed?
It means completely
Healed means cure.
completely
and
cured.
healing
Healing
And
means
means
getting
healing means
better day by day.
day by day cure.
And
We
health is
can code
completely cured.
healing. We can code healed. We should not code. Okay. Remember, pressure ulcer or normal ulcer. Healing documented you can code. Healed we should not code. Pressure ulcer described as healing should be assigned the appropriate pressure ulcer stage code based on the documentation in the medical record. We can code. Okay. Any doubts?
No doubts.
Thank you, guys. If you have any doubts, you can ask me.